I really do want to talk about actually conducting technology transfers and preparing for them. And I saw a great audience question come through before that I was saving for this last section here. Julia asked, beyond sharing the SOP for an analytical method during tech transfer, what other data would be helpful to share to make the tech transfer as quick and smooth as possible? Bill, you're on my screen. Why don't you take a crack at that?
Honestly, the best thing, in my humble opinion, that is possible to do is actually have the individual who is performing the assay at the sending facility and the person who's going to be on the receiving end actually in the same lab doing it together. It's the nuances of the method that the person who's doing the assay, the sending end, has sort of little habits that are in their laboratory conduct. Those don't tend to find their way into the SOP because they're just stuff you do.
Yeah.
But sometimes the stuff you do turns out to be actually a little more important than that. That ideal frequently isn't possible, but that would be the next best thing is spending a lot of time via some sort of telephonic, whether it's a Zoom connection or the telephone or something with visuals is always helpful.
Yeah.
But
yeah, SOPs can.
The communication, it cannot be overrated.
Yeah. Yeah, SOPs can't quite capture the nuance of a scientist kind of workflow of doing things. And there was Julie asked a follow-up question there, which is what would you say is the average amount of time spent on human-to-human conversation, like you're alluding to? Do you think that there's room in the industry to improve that? And what do you think there?
Yeah, so I think it depends on the assay, right? So a compendial method, for example, is not transferred from lab to lab. It's transferred from a compendium to the lab, right? So there's no transfer and communication, but that's conceptually the case, right? In reality, there could be some practice sharing anyways, right? But I think for very, very complex methods, such as the flow cytometry method we mentioned here, which is a very, very difficult assay to execute reliably, and is very platform dependent, meaning if you switch your instruments, or your timing will be off, and you'll be seeing differences, right? It may work for one product, but it doesn't work for the next product. It depends. You have to be testing this, right? So for something like flow cytometry, which in many cases is not fully automated. I mean, we at BMS, we trying to automate everything we do now, including all of manufacturing and testing. That's its own challenging project, but I think the lesson learned really is for something, the more complex a method is with manual operations, the more on-site training you need to do. You also really need to have an on-the-job training program that you have to build, where the practice to execute the method should be laid out. The SOP should be ideally a very short, concise, but complete document, but it's not good enough likely to be executed reliably when you have a lot of manual processes, and the way you're pipetting can make all the difference already, right? So that's something you can do. So we have done, as we are global already, right? We do a lot with video, So we take videos of the actual execution. and then we share those videos. If we cannot do actual on-site training, right? As we're US based, but we do Europe, we do Asia, right? We have operations there, testing there of our commercial products. So we do a lot over video now, but at least we're trying. That's one way to avoid the constant flying around, right, of SMEs,
Yeah.
long distances, right? And so that's basically very important to also to really stimulate your analysts that comes out of already of development, that the development analysts already starting to call out where is variation possible from an execution practice perspective, and what does it do, right? Because oftentimes the development scientists know these things very well, and they tend to do really well in their lab, the methods, but when they then go into QC environment where they do for routine testing, and when they then get transferred to a next QC person, etc., within their own training program, that's when we see issues, right? As that kind of a development scientist knowledge and the way they do things is not really transferred well. And so that's critical to keep that in mind.
Yeah. Bill, Cheryl, anything to add there?
I would just say I agree with what they both said. One thing that we do is the virtual classes, which helps for the going back and forth. But usually we have someone come here, we do the text transfer, then we'll do the virtual classes for the next few runs, testing runs, to make sure that we're doing it correctly, kind of as a backup. For us, we found it's very important for someone that's tech transferring to us here is for that person to come here, because they do need to see our lab. They need to see the QC workflow, because as Stefan was saying, the protocol development person has this, they do it in their lab, they have their ideas, but they need to come here because sometimes it might need to be tweaked or some changes, because the workflow in this lab may not be the same as the workflow in the other lab. So you have to make sure you're mimicking exactly what goes on between the two.